While millions of people work from home during the coronavirus pandemic, hundreds of thousands of essential workers and members of ASETUC continue to risk exposure to the virus by continuously reporting to workplaces to keep the economy alive and engage in precarious forms of work. Individuals that contract the virus are not only at risk of spreading it to loved ones and their communities, but also face retrenchment and wage loss when they become too sick to continue working. This results in a rise in poverty across countries. The union plays critical roles in crises like COVID-19 outbreak. It protects employment and wages. Unions provide legal assistance to claim work-related diseases compensation. As a movement, it can persuade governments to recognize COVID-19 as an occupational disease. Unions make workplaces safe and healthy. Governments are responsible for providing social protection to all workers, including compensation in times of illness. When COVID-19 is classified as an occupational disease, protection for workers increases in many forms. Medical care, wage replacement, and job retention are just some of the social protection benefits that come with having COVID-19 classified. The health crisis created by the global pandemic has pushed occupational health and safety to the forefront of discussions. In the ASEAN context, ASETUC was instrumental in Malaysian government's decision to recognize COVID-19 as occupational disease. Not all ASEAN member states have done the same. Brunei, Singapore, and Thailand recognize SARS as occupational disease, but not COVID-19. The rest only classify it as general as respiratory disease. This gap leaves many workers and their families at risk of falling through the cracks. To be a truly caring ASEAN community, the ASEAN member states must work in concert to classify COVID-19 as occupational disease and supporting strengthening workers and trade unions in development and implementation of occupational safety and health policies and programs. Respect workers' right to organize and bargain collectively as a tool to secure safe and healthy workplaces. Respect workers' right to refuse dangerous work. Provide social protection to all workers. Recognize COVID-19 as occupational disease. Let's make workplaces a safer place for you and everyone in ASEAN.